My name is Lori Muffly. I'm an associate professor of medicine at Stanford University. I focus my clinical care on adult patients with acute leukemia receiving transplantation and cellular therapies. And I perform a wide array of clinical research, including epidemiologic studies evaluating barriers to access to care. In the current research project, myself and my colleagues, my research group, we were interested in understanding geographical barriers to receiving specialty cancer care among adolescents and young adults with acute lymphoblastic leukemia. And the reason that we were interested in this question is based on some of the prior work that we and others have done, which has shown that specifically in ALL, it appears that outcomes are improved when patients receive care at experienced specialty cancer centers. And so we have been conducting a series of research studies looking at different kinds of barriers to receiving care at research centers. And one of the barriers that we were very interested in based on feedback from the ALL community and just kind of our own experiences is geographical travel barriers. And so for the current project, the question was really, where are the AYA-ALL patients living in the United States? And where are the specialty cancer centers? And how far do patients need to travel to receive care at their closest center? And so a few points of importance here is how we define specialty cancer centers. And so we use the definition of National Cancer Institute designated cancer center and or Children's Oncology Group designated site. And that's because we're looking at a cross-section of patients aged 15 to 39, some of whom may be treated in pediatric centers, some of whom may be treated in adult centers. And we used a variety of data sources for this project. You would think that this question maybe would be easy to answer, but it's actually not. So to investigate where the patients are across the country, we used a data source from NACER, which is a central repository for statewide cancer registry data. And using this resource, we were able to understand all of the patients with newly diagnosed ALL in the age group of interest over the last 15 years or so in the United States. We then used publicly available addresses for all of the centers listed as being either NCI designated cancer centers or COG sites. We also looked at the National Community Oncology Research Program sites or NCORE sites as a secondary analysis. We then used geomapping to determine the distance between the patient at the county centroid and the distance to the closest either NCI cancer center, COG center, or NCORE center. So we were able to map the patients, map the distance from each of these centers. And then finally, to make things even more complicated, we looked at predictors of what counties, predictors at the county level of a county being further from a specialty cancer center. And so long story short, we found that approximately half of AYAs with ALL live in a location where they would have to drive well over an hour, over an hour and a half each way just to reach an NCI designated cancer center for care. We found that the distance disparity was less for Children's Oncology Group centers. So a fewer proportion of patients would have to drive very far to reach those centers. And then finally, we found for the NCORE sites that geographical access was better to those sites than to NCI designated cancer centers. We found that rural counties, counties with more poverty, counties with more ethnic disparity tended to be more associated with further driving time from specialty cancer care, which is of course no big surprise. Why I think these data are important is because as we think of ways to get more of these young people with curative leukemia to centers with expertise, we're going to need to think on multiple levels. And this geographical access barrier is a huge issue to achieving this goal, because there are plenty of patients that live in regions where they would have to drive 2 hours plus, and that's just not going to be realistic. So either we need more centers, or we need kind of networks that allow for sort of collaborative working situations for clinical care, so that patients can receive the best care possible. And so that is essentially what this study was about, and we'll be presenting at ASH on Monday in an oral abstract session. And I appreciate you taking the time to listen.